Okay.
I am Dr. Kabir. What is your name?
My name is Isaiah Christian.
Isaiah. It's nice meeting you, Dr. Isaiah.
Nice meeting you too, doctor.
You can see our patient. Her name is Salma Salman.
Mm,
By her side is her mother
Okay.
that brought her to the hospital today. Salma Salman is a 5-year-old nursery one student, pupil. Uh, she was brought by the mother because she is sick today.
Okay, so can you please ask her, just tell me, or if they could tell me a little bit about more about what she's feeling, and then I can ask some follow-up questions.
Okay, you want to find out how she is feeling today?
Yes,
All right. Salma was brought by the mother because of fever.
because of fever. Okay.
Yes.
Okay. So let me ask, how can she describe the fever? Is the fever consistent or does it come and go?
All right. Wai yana tambaya zazzabinta yana zuwa ya dawo ne ko kuma yana nan all the time. Okay. So that the fever, uh, it comes and go.
Okay. The fever comes and goes.
All right.
Does she have
Yes.
any abdominal pain, stomach pain?
She doesn't have stomach pain.
Okay. Does she have constipation or diarrhea?
Wai tana gudawa ne ko wannan amana? Okay. She doesn't have constipation or diarrhea.
Okay. Um, when she is, I see that she has a cough. Does she have a running nose or sore throat as well?
Yes, she had running nose, but currently it has like subsided. The
Okay. So
running nose has subsided. You can see her coughing.
yes, I can. When she
Yeah.
coughs, does she cough mucus at all? And if it is there a smell to it or a color to it?
No, the cough is dry. She doesn't
Dry
cough
cough.
out mucus.
Okay.
Mm.
Okay. And so, let me ask, does she have any red spots or a rash on her skin anywhere?
Okay. Wai akwai wannan ne ko wannan ƙuraje jajaye a jikinta ko babu? Akwai ƙuraje? Babu. All right. The mother is saying there is no any red spot on the body or rashes.
Okay, no red spots or rashes.
Yeah, red
Okay.
spot or no red spot or rashes on the body.
Could I have her temperature, please, as it currently stands?
Yes. We check her temperature today is 38.9 degrees centigrade.
38.9 degrees, so it is high. Okay.
Yeah.
And you said that the fever was intermediate, it comes and goes, correct?
Yes, it was intermittent. It comes and go.
Comes and goes. Okay.
Yes.
So let me just recap what I am understanding to be her symptoms. You
Yes.
said that there is a intermediate fever
It,
that comes and goes. There is
yes.
a cough that I can see very well, and maybe some congestion,
Yes.
and as well as you said that there is abdominal pain, correct?
No, she doesn't have
Oh, no
abdominal
abdominal
pain.
pain. Okay.
Yes.
Okay.
She has fever. She has cough that is dry.
Mm-hmm.
She actually had associated running nose initially, but there is no running nose currently.
Okay, I have one or two last questions. Uh, as it currently stands, does she feel weak? Is she eating well?
Yeah, she's sick. She feels generally weak, but
Okay.
let me ask the mother whether she has been eating well or not. Wai
Okay.
tana cin abinci ko kuma ba? That the mother noticed that she doesn't eat well as she used to before the illness.
Okay, so but before the illness she eats well.
She eats well, but after the illness now, she has not been eating well.
So there's a lack of appetite.
Exactly.
Okay. So intermediate fever. Okay, I would like to have the results of a blood culture. Um,
Okay.
and I would also like to have the results of a throat swab to see if there's any bacteria in her mouth
Yes.
and or her respiratory system. And
Yes.
I would like to see the results of an uh, just to see. I don't necessarily know if she has it, but just to see, just to check all bases, is a rapid diagnostic test.
Okay.
Thank you.
We have done our throat swab microscopy culture and sensitivity,
Hmm.
and Staphylococcus aureus was cultured.
So she has
Hello?
bacteria. Yes, so she has
Yes,
bacteria in her respiratory
yes,
system.
bacteria was cultured on her throat, Staphylococcus aureus,
Yes.
and blood culture
Hmm.
did not yield any positive result.
Yes.
Rapid diagnostic test, the RDT was negative for malaria.
Okay. So she just seems to be having, at least we can't see a malaria present right now, but we definitely see
Yes.
an acute respiratory or upper respiratory infection of a bacterial nature.
Okay.
So what
Yes.
I would prescribe for treatment is
Okay.
supportive care. We're going to put antibiotics for the IV for
Okay.
the bacteria. And just in
Okay.
case it is malaria, I would definitely caution to continue to make sure that just because of the lack of appetite and the intermediate fever, that she
Yes.
and her family use netting and spray, whatever they have access to reduce that and keep good hygiene as well.
Okay. It's all right. We are going to ensure that the antibiotics is prescribed for the patient,
Yes.
and then the supportive care as well. What do you want in the supportive care to be given to the patient?
I'd like them to have IV antibiotics, antibiotics, and I would like uh, just because of the weakness when she gets her appetite back, to have the food fortification as well, and fluids, a lot of
Okay.
electrolytes to rebuild her immune
All
system.
right. Okay. Okay. You want her to have fortification of food. All right. Because of the poor appetite that she has not been eating for the time she has been sick. Okay. That will be done. We are going to ensure that she receive fortified food in this when she recover from this illness.
Yes.
All right. What again do you want to do for this patient?
So just to recap, I would like antibiotics prescribed for
All right.
the
Okay.
bacterial upper respiratory infection, as well
Yes.
as because she is not eating, to make sure that when she gets her appetite back, make sure she's eating and drinking a lot of fluids to get back her electrolytes and all the things that she's lost because she
All
hasn't been
right.
eating during this time. And also, as
All
a
right.
preventative steps, I would like her to make sure that she is not around mosquitoes as much as possible, using netting and spray, and just keeping good hygiene and
Okay.
sanitary practices.
All right. All right. That's very good. Uh, that is very good, Doctor. It is Isaiah.
Yes, sir.
Isaiah, that is really great. You
Thank
are
you.
a very good doctor. You are a very good doctor.
Thank
I
you
am
so much.
so happy and glad. I feel so happy the way you manage this patient.
Thank
You
you.
know, the way you check the history, the fever, you look for the pattern of the fever, the history of cough, you want to know whether it's productive or not. And then you also try to look for other causes of fever, asking for abdominal pain, asking about whether the fever is intermittent or no, to find out whether it's malaria that is causing this fever or other things. And you also went further trying to examine the patient. You investigate, you did a throat swab microscopy culture, which we have done for this patient actually. You see, that is very good
Thank
because
you.
that she has fever and cough, you should think of respiratory tract infection first. and
Yes.
which we have done culture. Throat culture reveals Staphylococcus aureus, which is a bacterial infection of the throat. And then you also did rapid diagnostic test just to make sure in case she has malaria, especially that she has intermittent fever. And the rapid diagnostic test was negative. You can see you'll be comfortable that this problem is only respiratory tract infection. There is no need for anti-malaria since there is no malaria. You also talk about treatment. You prescribe antibiotics. Yes, it's a
Yes.
bacterial infection. You have to give antibiotics. If it were like a viral one, supportive care may suffice. But in our own case, we were able to culture bacteria. We have to give antibiotics, which you did very well for this patient.
Thank you.
You are a great doctor.
Thank you, sir. I really appreciate it.
I wish I'm the patient here sitting, having this very big doctor examining me. I feel I will be happy to have this kind of doctor.
Thank you.
Yes, that's great.
Thank
Yes,
you. Please tell the daughter and the mother that I hope that she feels better
yes.
very soon.
Oh, great. So yana cewa wai a gaya muku cewa yana fatan ta ji sauƙi nan da kurkusa ba da nesa ba. Oh, you see, they are saying Mungode. You know what is Mungode in Hausa?
Th-
That's
uh,
thank you.
yes.
They are saying thank you that she's happy that you beyond treating her, you are also talking, you are praying for her for a quick recovery.
Yes.
You can see Salma is looking at you. She's eager to see who is this doctor that is trying to treat me now. I just told them that the doctor is coming all the way from United States of America.
Yes.
It's a privilege having you today, and it's an opportunity for them to be diagnosed and treated. You really did very well. I must tell you, you are very good. You will make a very good doctor out of you. Please, Isaiah, are you hearing me?
Yes, I am.
Please join us in this business. We are going to make a good doctor out of you.
Well, I really appreciate it. I will.
So, thank you very much.
Thank you so much.